Bunny is a 4-year-old crossbreed cat. To start with, we can always introduce ourselves to the animal and the client.
Hello, I'm Wei. How can I help you today? Hi, Dr. Wei. This is Bunny. I think it's time for a routine exam.
Before we start handling, we can do distance examination to check the animal's demeanor, coat, symmetry of body, BCS, aspiration rate. For a mature cat, the normal respiration rate should be between 20 to 40 times per minute.
Okay, let's do some physical examination. Hello, Bunny. I believe you're a good boy, right?
Meow. Make sure that we are friends to start with. Now we are going to do a nose-to-tail examination. Examination of the head starts with the visual inspection. For nose, we will look for facial symmetry, looking for depigmentation, erosion, lesion, or discharge from the external nares. To evaluate whether there is normal air flows through both nostrils, I am occluding one nostril with my thumb and observing any change of the sound or effort of the respiration. Then I will do the other one. The next is eyes. I'm stabilizing the head with both hands and using my thumb to stabilize the eyelids. I am parting the lid so that I can see the sclera and cornea clearly and depressing the top eyelid on the globe itself to protrude the third eyelid, moving over the other eye, swapping the hand while stabilizing the head. Now I'm examining the mouth. The first stage of oral examination is to lift the lip and observe the color and the moisture of mucous membranes, depressing on the gingiva to do the capillary refill time. Next, I retract the lips all the way back so that I can see the caudal teeth right back to the upper molars and then repeat that on the other side. The third stage of oral exam is actually opening the mouth. Grasp the maxilla with the thumb and index finger and lift the head slightly, which allow me just to pull gently down on those lower incisors. In order to properly examine the mandibular teeth, I have to use my finger to manipulate the tongue. I have a good view of the inside of the mouth, and my oral exam is complete. Next, I'm checking the ears. I lift the pinna to observe the skin of ventral pinna. It is often affected by allergic skin disease. I look down the vertical canal to look for any discharge and then palpate the cartilage of the ear canal to see if there is a pain reaction from the cat. To palpate the mandibular lymph node, I insert my thumb on the medial aspect of the ramus of mandible, grasp the tissues ventral to the ear canal, pulling that ventrally and feel that the node slip through between my fingers. I continue holding the head and palpate the neck and trachea, and move on to superficial cervical lymph node. To palpate the prescapular lymph node, I put my thumb in the thoracic inlet in the jugular groove, palpate the point of shoulder, grasp the muscle between my fingers and the thumb, and let the lymph node slip through my fingers. Skin pinch test. I lift the skin between the shoulder blades and release it. If the cat is nice and hydrated, the skin should return to its normal position quickly because it's elastic. Next, with the animal in a standing position, I palpate the thorax to feel for the axillary lymph nodes in the axilla to feel for any abnormal superficial lumps. Collecting the resting heart rate in this position, the stethoscope will be located in the area of mitral valve. To start auscultation of the chest, I palpate the apex of the heart, so I know where to locate the stethoscope. At the same time I'm listening to the heart, I palpate the femoral pulse to confirm that we have synchronized heart and pulse. I count the pulse for 15 seconds and times by 4. Then I move the stethoscope forward one more rib to listen to the aortic valve area. If I further advance the stethoscope cranially one more rib and a little more dorsally, I will be auscultating the pulmonic valve area. Then I auscultate the tricuspid valve area on the other side. To complete the auscultation of the chest, I listen to the 4 quadrants of the lung sounds. Dorsally and ventrally in the cranial position and dorsally ventrally in the caudal position. In each position, I listen to at least one respiration. I'm using the diaphragm rather than the bell because the respiratory sounds are very high frequency. We need to make sure that the cat is held still and standing, which facilitates our auscultation. Next, the abdominal palpation. My palpation is broken up into 3 parts: the cranial, the middle, and the caudal abdominal palpation. For the cranial portion of abdominal examination, I push my fingers ventrally within the costal arch to feel the liver. I rotate my hand slightly to feel the mid-abdomen and let in small intestine loops fall between my fingertips. And as I pull my fingers up, I may be able to feel both of the kidneys in the cat. Caudally, I am palpating the colon and the urinary bladder. I palpate the urinary bladder carefully by grasping the ventral abdomen from the ventral aspect until I can feel the urinary bladder between my fingers and thumb. For the muscle and the skin, to start off with, I am splaying the toes to look at the skin of the paw between the toes, which is commonly affected by the allergic skin disease. And then go through the limb by reflexing and extending each of the joints in turn. Ideally, just flex one joint at a time. Hug, stifle, and then we will finish off with the hip. And what I am palpating for is any reduced range of motion, any feeling of crepitus, and any obvious pain. All 4 of the limbs are examined carefully. To assess the coat and the epidermis, I am running my hands in the opposite direction to the hair. As I roll the hair back, I got the idea of the quality of the coat, and I can see the epidermis, looking for any obvious lesions and the scale production and any parasites. I grasp the legs that are closest to me and gently lower the cat down to the ground. Check the inguinal area, the axillary areas to know if they are affected by allergic dermatitis. If it is a female, I will also be palpating the mammary areas as well for any mammary masses. I now move to the inguinal area of the cat to feel for the inguinal lymph nodes and the popliteal lymph nodes, which I feel between fingers and the thumb, caudal to the point of stifle. Repeat that on both sides. To take temperature, I put small amount of lubricant on the tip of thermometer, lift the tail, observe the anus carefully, and then gently insert the thermometer. Make sure that I don't poke directly into the rectal fold, which can be uncomfortable, and directing the thermometer slightly to the side to press the tip against the mucosa rather than in the middle of feces and obtain the accurate rectal temperature.
And that concludes the video. Meow.